Hello everyone, let's try to solve this question together. So elevated blood pressures are noted in a preterm infant who is treated for bronchopulmonary dysplasia. So based on the information, look at the graph, look at the medication sheet, and the best intervention would be pause the slide, zoom the pictures. So what do you guys think is the correct answer here? The correct choice here is to continue to monitor blood pressure. So now let's see why the others are not the correct choices. So discontinue all medications. Again, you don't want to discontinue medication on a baby with bronchopulmonary dysplasia because you might take care of the blood pressure, but then the BPD itself can lead to respiratory distress and ultimately leads to failure. So respiratory failure and then effect on the heart. So you don't want to do that. So discontinuing all medication is not the right choice. Obtaining an echocardiogram just based on the blood pressure is not really indicated. If you are worried about pulmonary hypertension in BPD, then definitely echo is indicated, but this is systemic blood pressure problem, not the pulmonary blood pressure problem. So this is again a very tricky one, but you don't have to do as a first line. Renal ultrasound is a good option, but because we know, and if you see the here, patient was started on dexamethasone and patient is already receiving nebulized steroids and plus nebulized bronchodilator. So all these components could lead to hypertension. So it's a medication-induced hypertension, it looks like. The second thing, if you see that the trend is very variable for both systolic and diastolic, but the last values are okay with a normal limit. So without any intervention, and this dexamethasone is probably in the weaning phase, so that's why D looked like the best option. But if you have no cause and if you notice that hypertension in a neonate without any BPD or pulmonary disease, C would become the right choice here. Getting a renal ultrasound is very important because renovascular blood pressures are very common in adults plus in neonates. It could be arterial stenosis of the renal artery, it could be a thrombosis. So that's why that's become very important. Anyway, to summarize, in this question, follow the trend of the blood pressure, and basing on the medication list, the best choice is still continue to monitor, and then we'll go from there. So I hope you all have learned something together today. Please do like and subscribe to our channel, and you guys have a wonderful day. Bye.